Hi, welcome to the channel, everybody. Thank you for joining me. I'm Dr. Sylvia. This is Askawayhealth. Welcome to our Friday live class. If this is the first time you're popping on one of these streams, this is where we talk about anything and everything to do with women's health. So you're very much welcome. Don't forget to like this video and subscribe to the channel. You're going to get lots of valuable information, and we cover a range of different topics. So please click on your notifications so that you know when our new videos get published. For example, our latest video was published yesterday, postnatal depression. I'm going to share that with you because I want you to have a look at the let me get it up first for you. Yeah, I want you to have a quick look at the thumbnail so that you can recognize the video, but please go and check out this video on postnatal depression. Because this is such an important condition. Okay, postnatal depression can affect up to 15%, 10 to 15% of women. So please go and have a look at this video. It was published yesterday. It's just 8+ minutes long, but it's packed with valuable information about recognizing this condition, about how to deal with it, just learning what it's about. And it will be very useful, not just for women, also useful for guys. So if you've got a male friends, relatives, please share with them, because postnatal depression is common, a lot more common than we actually realize, and it's good for us to know about the condition. So I wanted to make sure that I signposted that to you before we continue. And today we have got a couple of interesting questions. Okay, we've got a couple of interesting questions. As you know, I love to share and discuss questions from my viewers. And this week we've got two people who've sent in questions, one relating to bleeding, one related to fertility, both about the depo shot. So let's just jump in. Without any further ado, if you're joining the stream, welcome. Thank you so much for popping in. Leave me a comment. Tell me where are you or where you're watching from. What's happening in your neck of the woods? Ask a question. Just join in and just be part of what we're doing. And if you're watching on the replay, thank you so much. Don't forget to like and the video and subscribe to the channel. So let us have a look at the first question. I'm going to share that with you, and then we can have a look at it together. Okay, so this is from one of my viewers, and she's referring to the depo-progesterone shot. She says, hey, I was on it for about 5 years and I got off it April 2021. My cycles still haven't regulated and I cramp. Will I still be able to have kids? Okay, that's one question. We're going to tackle it. We're going to look at the implications, and then we will end with some advice about what she will do, because I want to make sure that you have the information that you need. So that's one question. Thank you so much to Shateria for sending in that question. Thank you so much. Number 2 question is, I have my period all through 3 months. Sometimes it stops 2 days, starts tomorrow. Yes, sometimes it stops today, starts tomorrow, stops for 3 days, then starts again with clots and pain in my abdomen. I should get it back yesterday, but I refused to take, I think she meant she refused to take the shot. Now it starts again. I am weak and tired. It's like I lost too much blood. Oh dear. Yep. So guys, we're going to be looking at these conditions. We're going to be looking at these problems today. This is what we're here to talk about today. So please, hi to you guys hanging out in the comments, watching live. Please say hello. Tell me where you are watching from. Feel free to join in with any comments and contribution, your experience. We are all here to learn. Okay, so let us begin. Should we start with the first? Yeah, let's start with the bleeding. Okay, let's start with the first question. And let's start with the issue of bleeding. So what type of bleeding pattern? Because that's what she's saying, really. You know, what kind of bleeding can you expect when you start the depo? So what I want to talk about today, and I want to share with you, is what kind of bleeding pattern should you expect when you start the depo, when you go along your journey with the depo shot for, as you know, however long that you take it, and what should you expect. So that's what I want us to sort of focus on in this question, and hopefully, you know, end with some answers as well for this lady, so that she has a way forward, so that she knows what she's going to do with her doctor when it's time to talk about it. So yeah, let's just get into it. So I think the first thing, and what I always love to do, so if you're new, I'm a general practitioner. I love health education. I always like to set the background and give you a bit of information about what we're discussing, and it's a depo shot. Oh, I'm just going to have a quick look at the comments because just to make sure. Okay, so I've got a couple of people on the stream. They're sort of lurking. They don't want to introduce themselves yet. I'm sure they will soon. Okay, but I like to give you a bit of big background about whatever it is that we're talking about. Then we dive into the issues. So depending on brand, because there are a few different brands, the depo shot progesterone injection is taken between every 8 or 13 weeks to maintain birth control or contraception. Okay, so generally they can affect how your fertility, they can affect your fertility because of the way they work, right? So these are injections that contain progesterone. Progesterone prevents pregnancy by preventing ovulation, that is the release of an egg from the ovary. Okay, the other thing it does is that it can make your cervical mucus thicker, and that means that sperm cannot travel easily through the mucus, okay, to fertilize an egg. So it can affect ovulation, it can affect fertilization. Next, the injection can also affect or change the nature of the womb lining, meaning that an egg that is, if the egg manages to fertilize despite everything, it cannot implant. So it affects ovulation, fertilization, implantation. That's how the progesterone injection works. Okay, so according to the different brands, you may be giving the depo shot that goes into the muscle every 12 weeks. It can go into your bum, or it can go into your shoulder, or it might be the one that you give yourself. So that's the birth control shot you can give yourself, usually every 13 weeks under the skin. And I'm going to share with you just so that you're, I've got that because I wanted to make sure that you guys know I love to share, make sure that it's very graphic, and so you can see what it is and really appreciate my, the story I'm telling. So let me just share that with you. Fantastic. Okay, so I've got this email. Let me take away the question because that tends to, yeah, that's better. Okay, so now you can see the different types I'm talking about. So the top left corner, that's the depo shot I was just referring to. That's the one that can be given into the muscle, okay, and that's given every 12 weeks. And the bottom left-hand corner is the self-administered, commonly known as cyanopress in some areas where it's used in some countries, or areas where it's used, cyanopress. And to the right of that picture is the injection. I wanted you to see how small it is, just how little it is. There you go, just how little it is, and why it's that's the advantage in terms of it being being able to use it at home. We've got a tiny needle, and you can give this yourself, and usually it's given, as we say, every 13 weeks. And the last one, not so common in some areas, but it can be used, is called Noristera. That's the one to the top right hand corner. It's also an injection, progesterone injection. So yeah, so these are some of the options that we have available in terms of progesterone short injections that we have available. Okay, so those are the examples that we have at the present time. Now, in terms of how effective or how good the progesterone shot is, it is good. It is highly effective, okay? According to studies, when it is used properly, so you're using it correctly every 12 or 13 or 8 weeks, as the case may be, and you're using it correctly, consistently, less than 1% of women using it in that first year will get pregnant. How good is that? So that's more than 99% effective at doing its job. However, life gets into life gets in the way, things happen. So if you're not as consistent, it is still 94% effective, being used every 3 months in that first year of use. So overall, it's pretty effective, this method, okay? Just compare it to the male condom, which rocks in at about 85% in terms of how effective it is, and the pull-out method or withdrawal method, which is coming in at 73. So if you were already thinking, which method, simply based on effectiveness, this is how the depo shot ranks. Now, of course, there are other issues like side effects which come into play, your preference, and so on. And we're talking about side effects today. So let's look at bleeding pattern on the depo. Remember that we've got a question to address, but we want to have a little look at things in a global fashion. First, you should expect a change to your bleeding pattern, that is your menstrual periods, if you're on the depo shot. So say it loud and clear. You should expect that should be in the back of your mind when you start taking the shot that this might happen. And I'm talking about right from the first injection, the next few weeks and months before we get to a year. This should be your expectation. You may be in a small category of women that it doesn't affect your cycle at all, but you're in a small category because more commonly there will be some change, okay, to your menstrual cycle. And what are these changes? First one is where there is no bleeding at all or spotting. We medics refer to it as amenorrhea. So you may have come across that term. That means no period or spotting, say over a 3-month period from starting with the injection. So that's one possibility, okay? There's also the possibility of infrequent bleeding. So you have periods, but they're not as frequent as before. Maybe a couple of months in between periods. They could be heavy, they could be lighter. The periods have changed. You may also experience spotting. So then you hardly have periods. But when it happens, it comes in very small, scanty amounts, just spotting on your underwear or on your in your menstrual cup or your tampon or your menstrual pad or towel, whichever it is that you're using. And this can be irregular, so you don't know when it's going to happen. It can be a bit of a nuisance, as you will imagine. That's unpredictable. How do you get dressed? When do you wear your appropriate menstrual underwear? So it can affect your furnishing and all sorts of headache these things can cause. You can also have prolonged bleeding. So you're having the period carries on and on and on and on. It's not stopping. It's a very common problem that many ladies have. They bleed for a long period of time. So now you can imagine this is going to be heavy bleeding. With all that loss, there's going to be an impact on health. So it's not just that we're talking about, annoying bleeding, irritating, embarrassing. It's also having a health impact, because if you get anemic, you're going to feel very tired, get breathless, and all the issues associated with that. You may also have painful cramps as a result of the bulkiness of your womb, giving out all this blood because of the effect of the hormone. So these are distressing issues that can happen. I will say it again. The changes that you can expect to your menstrual cycle on the depot, there are a number of them. They vary from woman to woman. I can't look at you and say, right, you're going to have amenorrhea or you're going to have spotting. We don't know. We just know that these changes could happen in one woman or the other. And we want ladies to expect that there will be a change. What it's going to be, we don't know, but expect and prepare for it, so that if it happens, you're sort of ready to, make the move, decide what you want to do. At whichever, depending on whatever setup, whatever experience that you have. So these are the common things that happen. Now, this is when you first start taking the depot. First 3 months, 6 months, going into 8 or 9 months, you could have this to varying degrees. What we know from the research and studies is that the longer you use the depot, the longer you stay on your injections every 3 months, the likely result is that the bleeding goes down, it reduces. So some ladies may start off straight away with no bleeding in the first 3 months. Some ladies may have the irregular period I talked about, or the prolonged period, the first 3 to 6 months. But as you go down into 9 months and into a year, the bleeding for majority of ladies becomes less, to a point where there is no bleeding. So that is the trend. That's the picture. I hope you can see the picture. For somebody who starts the depot, this is what to expect. Please have it at the back of your mind. This could happen. It's common. Okay. So let's go to the question. I'm just going to pull it up just to remind us in case you've forgotten, or if you're just joining us. Let's pull up. I think it's this one. Yeah. So this is the question. I have my period all through the 3 months. Sometimes it stops today, starts tomorrow, stops for 3 days. So what's going on here? She's having probably having prolonged bleeding. Okay. And then she's having infrequent periods in addition to heavy periods, because she talks about clots, and she's also having pain because of the bulky womb and the things that go along with that. So what is it? How should she be thinking? What should she do next? So, like I've said, starting a method can affect your cycle. The first few weeks or months can be problematic, and things will settle later. Usually, we believe this happens within 3 months. Within 3 months. 3 months, magic number. Put that in your head when you're starting a new method. Generally, we would say, if your symptoms, the side effects or the troublesome side effects that you may experience from that method, if they are not distressing, if they are not troublesome, if they are not enough, these are not sort of getting you down. We will encourage ladies, please be patient for that 3 months, because that's the time that we usually estimate that things will settle down on that method. So we want to know whether things will naturally settle down. Now, however, our lady is beyond, she's well beyond this, because she said she's had it for 3 months, hasn't she? So we're well beyond that. What should she do? We will first of all need to start asking, could anything else be causing abnormal bleeding? Could anything be responsible for abnormal bleeding? So first, we will check for other problems. For example, sexual infections, sexually transmitted infections can cause an irregular bleeding pattern. It can make it heavy, it can make it painful, it can do all sorts of things. So what you want to ask in somebody who is on the contraceptive shot, who is sexually active, could she have an infection? And then the other thing as well is you want to check, could there be something else like a gynecological problem? Could she have fibroids, endometriosis? Could it be cancer? So you want to look at tests that you want to run for her. You want to look at if she's up to date with her smears. Those are the kind of questions that we want to ask. So suppose we've done that and it's all clear, but the bleeding continues. So in this instance, the question is, okay, should we continue with the method, or is there something that we can do in addition to the method to control the bleeding until, because we said later on in the year, after a year, the bleeding reduces. It may be that the bleeding will eventually reduce, and this is just a troublesome period, a troublesome patch. So she might want to decide, and this, I'm saying the lady, the person, because it's your body. We as doctors will offer you and say, these are the options, what do you think? And so we will want you to make that decision, but we'll help you with the information. So there are some methods we can suggest adding on, like hormones, that you could add extra hormones you could add for a short period, 6 weeks or 3 months, to help to calm the bleeding down. Then stop it and see whether the depot has settled in your system and you're no longer having troublesome bleeding. There are also some non-hormonal options that you can use to manage for somebody who is having regular bleeding, but it's very heavy, for example, and she's just worried that, oh, it's so heavy. Then you can use some non-hormonal methods that we can issue or prescribe that will help to control that bleeding, again, for a period of time, maybe a few weeks to a months, and then stop them and have a look at what's going on with the depot. Or the final option, stop it. Simply come off the depot and just look for an alternative method. Simply stop the depot, and we're looking for an alternative method that may suit you, that might be the more suitable option for you. So these are the possible considerations when you're having issues with depot bleeding, side effects from bleeding. There's so many different types. This lady's example is really not so unique. Many women have similar concerns. A lot of it is, number one, understanding the nature of the hormone. The quantity of progesterone that you're getting is a lot, because that shot is going to cover you for 3 months. That is 8 weeks or 13 weeks or 12 weeks, depending on the brand. So that's a lot of progesterone, and this is what it does to your cycle. It could have any of these possible outcomes. So I think it's really important to say that there is always a variation. What can happen in one lady may not happen in another person. Okay, so I'm thinking I probably will do another video looking at the best methods or best birth control methods for women with heavy bleeding. I don't want to go into that now. That will take us down a completely different, we'll just get distracted from our objective today. But watch out for that video. If you're interested, let me know in the comments if you want me to do that video. I think it will be useful, but let me know if it's something you want me to address as well. Now, what about, I promised I was going to talk about this a little bit. What should you expect after stopping the depot? Because that's also an issue. And remember, I have a video on the channel. Go and check our smart birth control playlist. I have a video that talks about depot after effects. So you stop the depot. Okay, you should settle down now. But some ladies have some issues. So please go and watch that video. But going back to today's topic, what should you expect with respect to bleeding? Again, it varies, okay? The effect of the depot on birth control, that's gone by 3 months. That's gone. So don't rely on it. Don't assume that because you're still having cramps or funny bleeding or whatever, and it's 4 months after you stop the shot, that it's still working. Please, no, don't assume. Even its birth control effect has gone, but it can still remain in the tissues, causing some of these other effects. Okay, so this can affect women differently. They might have heavy and prolonged bleeding. They might have irregular bleeding. Some women could have their cycle come back to normal. Okay, so it varies. And I think it's important that you have this at the back of your head and anticipate that. I would recommend that if things are still irregular, so if you're still experiencing irregular bleeding, by the time, where are we now? If you're still experiencing irregular bleeding by 3 months, I would say, if you're still having troublesome bleeding that you're not sure what's going on by 3 months, then please speak to your doctor to check. Yes, it could be a side effect of the shot, but you stopped it 3 months ago. It could be a side effect of the shot. Yes, it's not completely got out of your system, but it's a chance for your doctor to check different things, check it's not being caused by infection, check it's not being caused by any other gynecological issue, anything from 3 months after you've stopped the shot and you're still having troublesome symptoms. So again, I think, was it, let's see who it was. It was Shari Ann. That was a question from Shari Ann. I think we've covered it. Let's have a look. I think we've covered the question. She says she's weak and tired. She's lost too much blood. So a blood test to be useful to see whether this lady is anemic, whether she needs to have iron replacement. She needs to be having that discussion about alternatives or some other treatment that would help to control the bleeding. Those are the kind of discussions that she should be having around this time. So thank you so much for anyone who's watching. Please don't forget to like the video and subscribe to the channel. If you're watching on the replay, please leave a comment down below. I would love to hear your experiences using the depo shot. We're going to go on to the second question. I think we really covered that to quite a bit of detail. So let me just pull up the question. I'll remind you, we mentioned it at the beginning. So this is a brief one from Shataria. Says, I was on it for about 5 years. I got off it in April 2021. Okay, so guys, let's look at the timeline. Okay, let's look at the timeline. She was on the shot for about 5 years. Okay, so every 3 months for 5 years. How many? So that's what's that? How many shots would she get in a year? So it's 4, ending up with, ended up, so she had 20 shots, okay? And then she got off it April 2021, and we're just sort of in the tail end of August 2022. So she's been off it for about 18 months roughly. She still has symptoms. So she's one of those people that has after effects. So her cycles haven't come back to regular flow. She's cramping, and this is the key question here: is will I still be able to have kids? And I know that this is she's not alone in having this worry, and this is why I wanted us to look at this particular aspect and respond to this question. So I'm just going to share my screen, and I'm just going to go into, I've got a few areas I wanted us to talk about in respecting this particular topic. So a few areas I thought would be useful for us to look at, that I thought would be interesting for us to look at. So I'm just going to share my screen. Just to give us a bit of a nice backdrop. I like this picture. This is a picture of, it's a nice schematic description of this hand preventing the sperm from going ahead to fertilize the egg. So this is basically what happens in birth control or contraception. Forget all the jargon that we all talk about. This is what's going on there. Okay, so so the issues I wanted to cover are what exactly happens to your fertility while you are on the depo. What exactly is going on while you're on the depo? Then I want to talk about, does it matter how long you've been on the depo? So does the duration of time that you've been on the depo affect your return to fertility? So like this lady who's been on it for 5 years, is this an issue? Will it affect her return to fertility compared to somebody who just used it once, or maybe just used it for a year and just had about 4 shots in the year? What does it make any difference? And then the next thing I want to look at is, how soon after stopping the depo are you likely to get pregnant? So let's look at the numbers. Are there any numbers? What do we expect? Okay, and then I also want to look at, because I think it's relevant, other issues that affect fertility. I will talk a little bit about them. And again, I want to hear from you guys. This is such an important topic. Many women are asking questions about this. If you have any experience, if you have questions, please let me know in the description segment as well. Okay, so I'm going to give a bit of background, and if you were here at the beginning, then it's probably going to be a repetition of the same thing. But if you're just joining, I think it's really useful, and I want to make sure that you are very well informed about the depo shot. So let's review the injection. depending on the brand, the depot shot, you might take it every 8 to 13 weeks, depending. Okay. So they contain progesterone, and that prevents pregnancy by preventing ovulation. That is the release of an egg from the ovary. They also make the cervical mucus thicker. So that means they can prevent fertilization, because when the mucus is thick, the sperm can't freely and easily swim to catch the egg. As you saw in that picture. So just think of the mucus being like that hand holding onto the sperm, stopping them from moving forward. So that is the process of fertilization, which the shot can prevent. And lastly, progesterone can also change the lining of the womb, the inner lining, and so make it difficult for any egg that is fertilized to plant. So these are the main ways that this shot would work. Now, if you're taking, it depends on what brand you're taking. You might be on the depo-provera intramuscular injection, which is the one that a healthcare provider gives into your muscle in the bottom or in your shoulder, depending on whichever area that you guys agree on. Okay, or you might be on the Cyana Press, which is what is more popularly marketed as the one that you give yourself, that you can give yourself at home, as long as we've checked your medical background, check that you're comfortable with what you're doing. Then this is an injection that you can give to yourself underneath the skin. It's very small, as you can see on the right hand corner. It's tiny needle, so it's convenient for women who it's appropriate for, and that's given every 13 weeks. And there's a last example is Noristerat, which is the top right hand corner. That's given usually every 8 weeks, and the short-term injection, and still used in some parts of the world. So the injection is highly effective. The progesterone shot is highly effective when you use it correctly and use it at the same. You don't miss your injection shot. You don't delay it by 1 week or 2 weeks or so, as can happen with any busy woman. When you use it the right way, there is less than 1% of women who used it that fell pregnant within the first year of use. So it's more than 99% effective at doing its job of preventing pregnancy. If life happens and you can't use it consistently, its effectiveness drops to 94%. But it is still much better than using the male condom, whose effectiveness is 85%, or the withdrawal method that depends on your partner's ability to come out at the right time. That is 73%. So really, it has a lot to say for it. But let's not forget that a lot of women also have to deal with side effects, which you have to balance the whole thing. It can be as effective, but if you can't tolerate it, what good is it to you? So we're talking about side effects, and I wanted us to look at what happens to your fertility while you are on the depot shot. And I think the first thing I would say is that because it delays ovulation, the shot will delay. Because it prevents ovulation, the shot will delay the return of your fertility when you stop taking it. So that's the first thing to have at the back of your mind. It does this to different degrees than the pill or the implant. So all these methods can affect your fertility, okay? But they're not going to damage your fertility. They're not going to prevent you. They don't render you infertile. So all these changes are temporary, and they will return to normal when you stop the method. It's just that because there are different concentrations of the hormone in these methods, the delay is different. So in the pill, as you stop taking the pill, within a few weeks, by the next cycle, your fertility is pretty much back. I mean, consider if you forget your pill and forget it for 1 day or 2 days. We tell you, take it as soon as possible. If you have sex, go and grab a birth control method, because just 2 days of not being on the pill, that's it. The shot isn't like that. You have this injection, and for 3 months, you have this big amount of progesterone going around in your bloodstream. So it's designed to act for longer, and therefore the return to fertility will be longer. Okay, so I can hear you say to me, okay, Dr. Sylvia, we have heard. But how long? How long exactly? Okay, calm down. Calm down. Like I said, with the pill or the implant or the coil, things come back fairly quickly after you stop them. But the delay can vary from one woman to another, okay? Now, this is not from my mouth. This is what studies tell us. According to the United Kingdom Faculty of Sexual and Reproductive Health, the delay can be up to 1 year. The delay in return of fertility can be up to 1 year after stopping the contraceptive injection, the birth control injection. Okay? Let's narrow it down a little bit more. These studies tell us that most women, most ladies are ovulating within 6 months up to 12 months of stopping the depo. Okay, so like I said, it's not going to damage your fertility forever. It's not going to make you infertile. It causes a delay. It takes some time, because even though by the time you've missed the next injection, that is, you've stopped taking it, and it's 3 months, at that point birth control is off the table with the depo shot, but it still remains in your tissues. The hormone, it's still a residual tiny amount is still left. It's like when you squeeze, when we do our washing and you get your washed item is filled with water, you squeeze, or your washing machine or dryer squeezes out as much water, but there's still a residual amount. You hang it out on the line and it's still dripping. The progesterone is still dripping out of your system. Okay, still coming out of your system. I think is a good way to explain it. It can vary from woman to woman. So many of them, by 6 months, their ovulation is already returning. And for some women, it may not be as common. Their fertility might even return by the first month after they've missed their injection. So they can be fertile or even fall pregnant. Some women can have that experience, which is why we say when you stop the depo and you're not going to have another shot after 8 weeks or 12 weeks or 13 weeks, please start another birth control method if you're not yet ready to get pregnant, because these things, we can't predict them. They vary from one woman to another. Right, I think I have beaten you over the head with all these statements. I think we can move on. So what about we want to get pregnant? Okay, how soon after stopping the depo can I get pregnant? Having said all this, I'm just going to have a quick look back into the chat. If anybody's joining, hi, hello, welcome. Thank you so much for joining. Where are you joining me from today? Have you any comments? We've been looking at the depo shot effects. We're talking about bleeding, and now we're talking about fertility. If you've got any comments or questions, let me know, please. I would love to hear from you. And if you're watching the replay, don't forget to like the video, please, and subscribe to the channel. Guys, drop a comment as well. If you found this video helpful, if you're going to share it with somebody, if you've had an experience, I'd love to hear back from you. So the question is, how soon after stopping the depo can I get pregnant? Okay, this is what the studies say. Again, I'm giving it to you straight as what we've seen from studies looking at different women, different countries. And it takes on average about 10 months on average. Remember what average is. So you have in the middle. So you can have women who it's less than 10 months. You can have women who's longer than 10 months. But on average, it takes 10 months to get pregnant after stopping the depo. So for some women, it can be less. For some women, it can be longer. But on average, 10 months is what you should expect after stopping the depo. Why is there this delay? I've mentioned it a little bit, but I want it to be very clear in your head. If this is something that you've been mulling about, worrying about, it's simply because when you stop the injection, the protection lasts only 3 months, okay? But the drug can remain in your muscle tissue for much, much longer. 10 months is the average time it takes to return to fertility. But listen, please, some studies indicate that by 18 months after the last injection, a woman who was on the depo will have the same fertility as another lady who did not have the depo. So what you're hearing from me is that some women could experience delay in fertility up to 18 months. That's difficult to hear. Okay, but I went looking for this information, particularly because of this question that we got from our viewer who sent in, from the lady who sent in the question. So by 18 months after using the injection, we would expect a woman who was using the depo, who stopped the depo 18 months ago, for her fertility to have returned to what is normal, what is usual, what is expected, or what is comparable to other ladies around her who have not used the depo. And this brings me into that other interesting question. What if you use the depo for a long time? Because some ladies use the depo for, just a couple of doses, 6 months. Some go on for a year, some 2 years. Some, like our lady today, have used it for 5 years and longer. So what does it mean? Does this mean their fertility is more affected? Is this a bad thing or not? It's a very good question, okay? Now, the answer to that is we don't exactly know. We don't exactly know. We haven't got any evidence to examine. So they haven't studied it in people, in the scientists who look at women using the depo. That particular issue hasn't been examined, whether or not the duration of use of depo influences the return of fertility. So that's why I can't tell you, oh, blah, blah, blah. I can't tell you that because we haven't, I wouldn't come and tell you something that there isn't any sort of evidence backing it. I can't, even if it happens to my good friend or my good friends, I can compare what happened to this person versus what happened to that person. That's not really a balanced way to look at it. If you're doing a study, you want to make sure that the women in the study are exposed to similar circumstances so that whatever result you get is comparable. Okay, so we haven't got that information. And I can't tell you that if you've used the depo for 10 years, you're less likely to get pregnant than somebody who's only used the depo for 12 months, because we don't know the answer to that. We haven't studied it. However, we can say that it may depend, that return to fertility can depend on other things. For example, your age. Okay, what if a 32-year-old lady uses the depo shot for 1 year and a 27-year-old lady uses the depo shot for 5 years? Whose fertility will return quicker? What do you think? I would really love to hear what you think. But the point I'm trying to tell you or explain to you is that it does depend more than just the injection. The injection, progesterone, is not going to damage your eggs. Is not going to damage your eggs. So it's just the fact that the circulating hormone can still prevent the body just functioning as it should in terms of ovulation coming back to what it should be. But it's not that because you've used the depo, it's been doing odd things like killing off your eggs. That's not what's going on. Okay, so let us then explore, to be able to answer this question. Let us ask ourselves, what are the other issues that could affect fertility? Because I think when you want to answer the question, will I still have kids, then it's useful to think what else could prevent or help somebody who's asking that question, can I still have kids? So your fertility can be affected by much, much more than how much hormone is left in your tissues after you stop the shot. Important things are your age, number one. Please remember that even if ovulation has been prevented, the hormone is not damaging your eggs, but your eggs are aging. They are growing older as you're growing older. So your egg quality at age 37 is not the same as your egg quality at 22. That's nothing to do with the depo shot. That's your egg quality because of that time has gone. So this can affect your chance of pregnancy. Age. Other things are your lifestyle. And when we talk about lifestyle, habits, things like whether you smoke, whether you take alcohol, whether you're overweight or underweight, mental health, stress-related issues, anxiety, and work-related problems, different pressures that we in our world experience. And that can affect a person differently regardless of age, because a lady who's 22 can have mental health issues or stresses or anxieties. So can a lady who's 34 or 33. So it can affect us differently. Other issues that can affect fertility are medication. Are you taking any other medication? Pre-existing health conditions. All of this can affect a woman to different degrees. Okay. So to answer this question, let's pull up the question so that we are looking at it together. I was on the depo for 5 years. I got off it in April 2021. That is, we said it's about 18 months ago. And she wants to know, will I still be able to have kids? Okay. I don't know how old she is. The shot has been in her system for 5 years and it's working its way out of her system. As you can tell, it's still a little bit in her tissues because she continues to have cramps. And she says that she's having issues with her cycle. It may all be down to the depo, yeah, but it could be something else, okay? It's likely the depo if she's otherwise healthy, no other medical conditions and so on. But we don't know this. I don't know that. We're just sort of working on the information that we have. So now that we're at around 18 months, Giving the evidence, I've told you, we have evidence that by 18 months, a woman who has stopped the depo, her fertility will be the same as somebody who didn't use the depo. So given that she's at 18 months, I'm fairly confident that if there's nothing else, okay, if there are no other problems, that she should be able to get pregnant. She should. I would give her that reassurance. But I don't know all her medical background. It's really important. We need to think about other things that determine fertility. I've just mentioned them: age, lifestyle, medication, pre-existing conditions, and so on. These are things that I don't know. So she would need to, we need to look at those in the mix. What should she do next? I recommend she should go and have a sit down with her doctor if she's not done that already, so that we can examine these details. We can look at her medical background, look at any issues, problems, medical problems. If she's on any medication, we can look for any issues that may account for why fertility hasn't returned. But bearing in mind that it could well be the depo, okay? But I think it's good enough time for her to go and sit down. If all that is normal, if we've done all that and nothing's found, it's simply about boosting her fertility, being patient and just boosting her fertility. Of course, looking at her partner as well. And I would recommend avoid stress. Avoid stress, eat well, take exercise, look for exercise that you love to do, exercise that keeps your heart ticking, that keeps your body, your muscles supple. That might be swimming, it might be yoga, you might be interested in different types of exercise, whatever it is that you enjoy doing, simple walking. Keep yourself in a good, healthy weight, at a good, healthy weight and fit, because you're preparing for your baby. Please rest and sleep. Can't overemphasize these things. It's a busy world, but you really need to make sure that you have established your me time properly. Nothing toys with it, nothing messes about with your me time. Stick with it. Pregnancy supplements. Avoid alcohol and smoking. And most importantly, make sure you are having regular sexual intercourse at least 3 times a week. And these are the things that put together, mix them up in the pot. I feel confident that you get pregnant. And I really want to assure, if she's watching the stream, I've already responded to her anyway, but if she's watching the stream, I really want to give her that assurance that she can still get pregnant. Guys, so what do you think? These are the considerations and the answers to these 2 questions of the week. I hope you found that useful. Again, let me know what your experience has been around these areas, what you found, what you found with these things, how you felt with them, whether it mirrors your own experience, whether you have or know somebody who's gone through something similar, or what their journey was, or what your journey has been in terms of fertility after the shot. We'd love to hear from you. As you can tell, we still need loads and loads more studies in this area to be able to answer these practical questions that we women are asking about this method. So please let me know what your experiences are, and let me know in the comment section when you're watching this again on replay. Thank you so much to everybody for sticking with me. It's not been a very long one, I hope. But please like and subscribe. And please, again, don't forget to check out the latest video. Okay, the latest video, like I said, is on postnatal depression, a very important topic for our time. If you're just joining, we are rounding up pretty much, but we've had a very, very good discussion. I wanted to make sure that I covered quite a few points. So please go and watch the replay. We had a very good discussion about the depo shot effects on fertility and bleeding problems, period problems. But I also want to direct you to my recent video on postnatal depression, 6 facts on postnatal depression, and it applies to both couples, okay, to a couple, not just a woman and not just the man, relatives as well, friends, because they're the people that can often pick out that something's not quite right after a lady has just had her baby. It's packed with helpful information. So guys, it's been fun talking with you. Thank you so much for sticking around with me. Please join me again next week when I have another topic to explore. And again, if you want to send in your question and ask me to consider it in a live stream, or if I think it's really interesting and get some similar questions along that same theme, I will definitely be happy to share it on a stream. So please have a great weekend. Thank you so much for joining me. I hope you stay well, and I'll see you again soon.